Hey listeners, today's headline is, Agitation and Dementia Can Be Helped by Medical Cannabis, study says. A new clinical trial has found that a blend of THC and CBD, two common components of medical cannabis, eased agitation in patients with advanced dementia near the end of their lives. The study involved 120 patients and was presented at the Alzheimer's Association International Conference in London, though it hasn't yet been peer-reviewed or published. Let's dive into the details. The trial focused on people with advanced dementia who were already struggling with agitation, a symptom that affects almost half of those in the last stages of the disease. Agitation can include aggressive outbursts, vocal frustration, moaning, repetitive movements, throwing objects, and even physical violence toward others. Traditionally, doctors turn to antipsychotics, anti-anxiety drugs, or opioids, medications that often fall short and can cause serious side effects, such as confusion, sedation, or even an increased risk of death. In this study, participants received a combination of THC and CBD over a period of 12 weeks. The results were striking. Nearly 90% of the patients on the cannabis blend reported reduced agitation. By contrast, only about a quarter of those given a placebo saw any improvement. Those numbers suggest a potentially powerful and, according to experts, safer alternative to the standard pharmacological approaches. One of the most compelling stories comes from the patient's family. Denis Gonzalez, who cares for his 87-year-old father Emilio Mine, was skeptical about enrolling his dad in a medical cannabis trial. He had heard fears that cannabis might worsen aggression. Yet after starting the treatment, he noted, while he was on this treatment, all that changed. Emilio, who was previously highly agitated to the point of aggression, began to show calmer behavior, something his family had begun to doubt was possible. Experts voiced cautious optimism. Elizabeth Edgerly, a licensed clinical psychologist and the Alzheimer's Association's vice president of care and support, highlighted that while the findings are preliminary, the results look really promising that it could be something that could help people with advanced dementia. She emphasized that a safer, effective option would be a huge improvement over the current standard of care. Beyond optimism, the clinicians also addressed the mixed evidence that has clouded cannabis research. Dr. Kevin Hill, director of addiction psychiatry at Beth Israel Deaconess Medical Center, noted that earlier studies have been contradictory, which underscores the importance of rigorous trials. He was not involved in this new study but said that the data now deserves careful evaluation. The study's methodology involved a carefully formulated and administered cannabinoid treatment. Participants received a standardized dose of THC and CBD, and the treatment was closely monitored for safety. Even though this research has not been peer-reviewed, the almost 90% reduction in agitation is a significant finding that may change how clinicians treat these challenging symptoms. In short, medical cannabis, specifically a balanced mix of THC and CBD, could offer a hopeful new strategy for patients with severe dementia and their families. Of course, more work is needed to confirm these results and to fine-tune dosing guidelines. Still, for families like Denis Gonzalez's, the improvement in Emilio's quality of life offers a glimpse of relief. That's all for today's quick roundup. If you're looking for more, you explore the full study once it's published, and talk with your healthcare provider about the best options for your loved ones. Thanks for listening, and we'll see you next time. _sign_off